Well, Canada seemed to ignore this pandemic for the longest time and only very recently started to close off border travel, and to this day has not done mass testing, and face masks are hardly available. A country that seems to have known what was coming, perhaps from experience, and has taken public health steps that have not shut down its economy, is the Republic of China, also called Taiwan. We've been trying to learn more about Taiwan's approach. I think one of the most important factors is it has been banned from the UN's World Health Organization because of discrimination from communist China, so they've had to go it alone, and in my view, they've made better decisions as a result. But today we speak to an expert on the ground in Taiwan who has generously agreed to be interviewed by Skype despite the time zone difference. May I introduce to you Dr. Peter Chang, a public health expert in Taiwan who is taught around the world, including at universities in the United States, Indonesia, Kazakhstan, and of course Taiwan. He joins us now. Dr. Chang, what a pleasure to meet you. Thank you for taking the time with us.
Yes, it's also my great pleasure to talk with you.
Thank you. Let me start by asking, how did Taiwan know this was going to be a serious question? In the West, I think people were waiting. It was like we saw a problem off in the distance, but we all sort of thought we were in a different reality over here. How did Taiwan know to take steps as early as late December?
Well, we have been working on with WHO issue for many years. Actually, I recall the history of not being well informed and very isolated in the SARS period. You know, we were the last one to get the SARS, and the last one to get out SARS. And when we get out the SARS, we find we are just like an orphanage. You know, there was no one care about what's going on in Taiwan, and we had to take about actually 4 months after the other countries to get out the SARS, Canada included. So we have been quite cautiously about what's going on, which is WHO can afford information. But before that, you know, 1998, there was the enterovirus in the Southeast Asia, and we were not aware of that. Malaysia got big hit by the enterovirus, and we got 400 cases, including 71 kids were killed by enterovirus. And I was, by the time, working in the health ministry, at a very early stage of my career, and we find out we didn't get anything from outside of the country. And including in year 2000, I will give you another example. In year 2000, West Pacific WHO having declared polio eradication in the region. But why is that so late? Taiwan was the last one getting the polio in 1983. And there was a problem that we cannot prove it to WHO that there was no poliomyelitis in Taiwan. And we have to call Australian international expert to come to Taiwan to observe and do evaluation that send a report to WHO. So, you know, we are not new to see the situation. It's very awkward. It's not totally healthy at all that we have information we cannot share with WHO, and we got a blockage by the China all the time. It has been 20 years. Now, so with this long tradition, at least more than 20 years alertness that we have a problem with WHO, and we don't know how to handle the situation in China, including the health issues. And I was, in late last year, I was talking with our CDC person. You know, I'm ombudsman in Taiwan. I was talking with our health ministry on a constant basis. And I was talking about how often do they get information from China about the health infectious disease. And there was a discussion about, well, how can we improve it? So in late December last year, there was a newspaper already in our local, and they was reporting some doctor in China was sharing their personal note about observation of this particular unusual pneumonia. And that recall us that in 2003, the SARS appeared to us is like the same. And we have a quick note, well, will that be the same thing? So in late December, there was our CDC person already take note about what's going on. So they sent an expert to China in Wuhan in early January. And that was real action to see, oh, there was a problem there. So I put it the long way, but you see, we are in very close to China, and we are aware of there was something we cannot handle. There was no information sharing. We are always on this alert, and that makes us well prepared.
Wow. So you saw reports of this, and you sent your own experts to Wuhan. I presume this was done informally. Did the Chinese government try to stop your Taiwanese experts from going to Wuhan in January, or did you just go as private tourists? How did you get into Wuhan in those critical weeks to see for yourself?
Well, there have been requests by our CDC to Chinese Ministry of Health on this visit. And they was not allowed to get into that area until at least 2 weeks after their application that they got permitted. But they was only coming very informally. There was not official visit. Certainly, this officer, expert from CDC, but they were only coming to Wuhan as an official visit. And they was able to talk with some of the doctor in the hospital. And because they were aware of this might be something wrong there, so when they come back, they have a press conference. And they say that likely there were human-to-human transmission in early January when they come back to open the report. But you see, in December 31st, our CDC already sending a note to WHO, and Chinese authorities say that we were aware that there might be something wrong about this atypical pneumonia. Can you rectify that? I mean, but there's no reply at all from WHO and from China. And that's the reason they send continued requests. Maybe we can send our expert to Wuhan. You see, that is the late December last year and early in January.
So the World Health Organization, they were unhelpful as well, is what did I hear you correctly there, that both the Chinese government and the World Health Organization were not cooperative? Did I hear you correctly?
Yes, that is right, because we are in international health regulation, like a local contact point. And we were supposed to send requests or send information or send out alert to IHR, which is the global treaty. Everyone should respond to that or the right to that. If there was it's a community networking that you tell someone what have you observed, or maybe you answer a question or you share your information. But when the CDC in Taiwan send that kind of inquiry, that they have been very modest. They say that we learned something might be going on. Are you aware that this is going to be a human-to-human transmission? WHO has nothing reply.
Wow. Now,
until 2-3 weeks later. Yeah.
So you started to go on alert very late December. You sent a team to Wuhan. So you were on the alert early. Now, we've studied how your country produces about 10 million face masks a day and distributes them through pharmacies, so there's not hoarding. People don't buy them up. And I've spoken to your embassy here in Canada, your economic and cultural office, and they say that there's a rule that Taiwan cannot export masks. The masks are for domestic patients, which makes sense to me. Here we are in early April, and I feel like Canada has only just in the last couple of weeks taken this seriously. We don't have masks. We don't have testing. And on the other hand, we don't have those protections. but so much of our country is in total lockdown. No schools are open, no restaurants are open, no theaters or anything like that. Can you tell us how Taiwan has allowed people to continue to work, go to school, and even go to some restaurants? How do you get out of the total lockdown that we're in and get to some normal kind of life, maybe just with masks and testing?
Well, it's not one step. It's many steps in consequence. That in January 23rd, our premier already said that we have to produce a big number of the masks, but by the time we will only produce 1 million a day. It's not enough. We got a 23 million population. And so the premier said that, well, I'm sorry, we cannot export. We should increase our production until we will be able to supply that to every individual. Every individual has a right to get a mask. So I think the mask is already in our culture. It's not a big deal. If the government or if the teacher asks people to wear a mask, people would wear a mask. Just like you wear a glove, it's cold, you put on the coat. It's no big deal. So it's quite easy for us to get used to that new protection, to wear a mask and wash your hand. So in late January, we already do that and increase the production of the mask as much as possible now. It's going to 15 million a day now. So we will be able to start thinking about provide some of this mask to outside the country. So wearing a mask is the very early stage, but also we cut the direct flight from Wuhan to Taiwan very early, and that is very critical. And then there was other airport in Hubei province. So we was trying to, we have thousands of people coming from China to Taiwan. On the other hand, every day, and that's the reason we are at the highest risk. And the first that we cut down the flight. There was no direct flight from Wuhan. And there was 1,000 of people from Taiwan, they remain in Wuhan until recently. I'm sorry for that because we have to cut it. And we minimize the entry from Chinese air flight coming to Taiwan. That's the first very important step to stop it. Now, certainly, they're putting a lot of alert to the public that the pneumonia is really coming. And we have to practice everything that you see we don't have. Until today, we got 360 cases so far confirmed. Compared to many other countries, this is incredible. This is unbelievable. That though, because we check in all the entry from the airport, from the airlines, and check in every contact. There were more than 50,000 people already being chased about are they in contact, and they have to be asked to stay at home for 2 weeks. We are really crazy about checking every potential, but there was no complaint by the public at all because people see that if we don't stop it in the early phase, they will go to a hospital, and the hospital will be bombarded with too many cases. And, many other countries, they lost their hospital capacity very easily. Yeah. So I think we take from early mid-January until now, 3 months is already, we are on this alert that, we are kind of enjoying still the liberty to travel, to go shopping as long as you have to wear mask. We have to wear mask when you are on the subway or you are on the bus. Now, if you go to the post office or you visit the bank, it's possible you have to wear the mask. So we are using our mask, but giving us the liberty to traveling around. The school is open. The university is open. So, there's a trade-off. You're losing some of that entertainment luxuries, but we got the liberty of still keeping the life going on.
Yeah. Well, when you say that you quarantined 50,000 people out of a population of 23 million Taiwanese, that's 0.2% if my math is correct. 23,000 would be 1/10.
50,000 in total from mid-January until now.
Right.
So
that's incredible to me Because in Canada, because we did not shut down our flights, now 100% of our population is under some restriction, not 0.2%. Let me ask you one last question, Dr. Chang, and I'm so grateful for your time, and thank you for arranging this interview despite the time zone differences. So you've told us a little bit about how Taiwan found out about the virus and how you locked down flights from China and how you ramped up mask production more than 2 months ago. That's something that hopefully we can learn from in the future. But in Canada today, we have a lockdown of a great many people. Our public health officials are still saying we don't need masks, which sounds absurd to me. And they're not really disclosing a lot of facts about their models, about their projections for who's going to get sick and how many people. If you had any advice for Canada today, not what we should have done a month or 2 or 3 ago, but how we can get out of this trouble today, do you have any advice for Canada or America or other Western countries that really were caught sleeping?
Well, information, is like intelligence is the most critical in fighting. When your enemy is a virus, we need a very, very good intelligence. When it started in Wuhan, Wuhan is a big, I would say is a 40 million or 60 million populations. And there are many, many people coming out of Wuhan before Christmas. Many people didn't realize there are many, many rich Chinese. They travel out of Wuhan for Christmas, for shopping. These are the middle class, rich people. They are not working. They are not just they are not working class. They are rich. They're going out to New York, to Paris, to Milan for Christmas shopping. So before Christmas, there are already many, many people from Wuhan, Chinese, travel out of Wuhan. And you see that the alertness of this is usually people say that it's January, February. No. Actually in December, Christmas, before Christmas, and even during the Christmas period, many Chinese people, at least 1 million of them, already travel outside of Wuhan, coming to every part of the world, right? If you see New York, if you see London now, it didn't happen in March, in February.
Right.
The cluster of this virus already in the city in the Christmas period.
Right.
In a small numbers.
So
and they're spreading. So therefore, the intelligence to lower down the passenger from the epicenter is critical. Now, if they already come to the community transmission, if you already got a lot of cluster in family, in the schools, we need to protect the people by mask. You limiting them at home. That's right. But it's big sacrifice, right? You cannot go shopping. You cannot go to school. So wearing mask as early as possible. Washing hand, because this respiratory droplets is really coming from person to person. When people talking to each other, when they cough and sneezing in the environment, I would say a lot of public toilet in the airport was tremendous dangerous because those are no ventilation. So my suggestion, well, in different period of time, in Canada, you already have got a lot of cases. You need to lock down the city, a community. That's right. But one way or the other, you cannot having people inside the house too long. They have to do daily activity. Wear mask, wash hand, and limit a big cluster of the population. Then slowly you will get those virus or the infect people going down.
Very interesting. Well, Dr. Chang, thank you so much for joining us today. I've learned a lot, including how early Taiwan took control of the situation, of its own situation, despite the best efforts of Communist China and the World Health Organization to stop you. Congratulations on being one of the most successful countries in the world to fight against this virus. I think we should all study the case of Taiwan as a template for what we should do now and even more importantly in the future. Thank you for your time today, Doctor.
Thank you for inquiry and question. I wish you all the best and good luck for Canada.
Thank you so much. Well, there you have it, Dr. Peter Chang, a public health expert in Taiwan, previously the advisor of the Taiwan Health Ministry on European Union affairs at the European Commission. That's an excerpt from my daily show, The Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.